Hi everyone, I'm Diana. I'm one of the PZR docs at Mount Sinai Beth Israel in New York City, and I'm excited to be moderating this session. We're entitled Academic Promotions Going Up the Chain in Simulation. And so first introduce each panelist, and then they'll talk about their careers and how they've obtained their promotions to where they are now. So our first panelist is Dr. Todd Chang. He is an associate professor of clinical pediatrics and medical education through Keck School of Medicine of USC. His research interests are in medical education technology, and he's currently the vice chair of education in the Department of Pediatrics and also the principal investigator for PCARN there. He is also the medical and research director for Las Madrinas CHLA Simulation Laboratory. Dr. Michael Cassara is an associate professor of emergency medicine through Donald and Barbara Zucker School of Medicine at Hofstra Northwell, as through the Hofstra Northwell School of Nursing. He is the medical director of Northwell Health Patient Safety Institute and Emergency Medical Institute. He's very active in emergency medicine as well as in simulation, and is the past president-elect of SAEM Sim Academy. He's currently a reviewer for AAMC's MedEd portal, as well as Western Journal of Emergency Medicine, as well as many others. And then our third panelist is Dr. Elise Braley Chardy.
You got it.
I did research on this.
I'm not picky.
Yeah, there was actually, I'll tell you guys a funny thing. So Steph had come on, and she's at BU, and BU recently changed the name of their medical school, and it's this very difficult, long name. And I did research on it as well, but when I actually had to do it, I chickened out and didn't do it. And the funny part about it is that my brother goes to that medical school. So Dr. Elise Braley Chardy is a professor of emergency medicine at UConn Health. She is currently the ED medical director and vice chair of emergency medicine academic affairs. She has a master's in biomedical science and an MBA in business admin, in addition to her MD. She has received multiple teaching awards, including faculty teaching awards, as well as SAM's Sim Academy's Distinguished Educator Award. She's very well published and has an interest in administration and Sim training. So we'll have each panelist talk a little bit more about their career paths, how they got here, and then we will open it up to questions. So whoever wants to go first can just unmute.
Okay. Hi, I'm Elise Braley Chardy. I know several of you on this panel because we kind of came up together, and I was Tina's fellowship director, sort of. Hi, Tina. So I am the medical director at UConn. I did residency in Connecticut, and then after residency, I did a sim fellowship at Hartford Hospital, which is a big sim center in Connecticut. UConn has a little sim center, but Hartford Hospital is a nice big facility. So I was the first fellow there and kind of wrote the curriculum. And then during fellowship, I belonged to the Sim Academy, which was awesome. And I got involved in a bunch of projects. And while I was doing my fellowship and afterwards, I was able to work with Mike and many other kind of very important people. I was quite young at the time, but we got to publish objectives for Sim fellowships, basically a consensus document, which lots of people use, apparently. So after that, I hung out at Hartford and was APD and was still an assistant professor and did a bunch of stuff, created an intern orientation curriculum, worked with the fellowship. We got more fellows like Tina. They came up. And then about 7 years into my career at this big tertiary care center at Hartford, being the APD, I moved over to UConn because there was an opportunity to lead their sim center. So I ended up moving over to the smaller academic facility and opening a small sim center for the students, which Tina was the fellow that year and kind of helped us get it up and running. And so my first year there, I went up for associate, and I used the intern orientation sim curriculum that we had created over the years with Tom Nowicki, my mentor. And we used that along with publications and awards. So I used that for my assistant to associate promotion as my capstone project, and it had outcomes, and I showed the milestones improved for central line training and other such elements, and then stayed on as the sim director of that sim center for about 4 years, And then the medical director opportunity came up, which is the pathway to chair where I am. So I had to do some admin work. So kind of went that direction. But in the meantime, ran the transition to residency course for the fourth year students, created that from scratch with much help, right? Tina helped me with many of those sessions when we first initiated it, and then used that for my capstone for promotion to professor, all while presenting, publishing, doing all the good stuff you have to do for that. So I talked enough.
I'll jump in second. I always follow Dr. Falichardi in all ways. So she was the president of the Sim Academy before I jumped in. So I'm gratefully following and trying to sort of fill the shoes. So I'll try my best here. I guess my career started, I graduated residency in 2000 and there weren't fellowships. And simulation, I think, was something that was there, but not where I was, that's for sure. And yet by 2003, this idea that you could start to engage in simulation education and just the idea that you could be a clinician educator and actually teach alongside a clinical practice was something that was sort of becoming like new and at least appreciated in the same way that you could do research or you could do EMS or some other subspecialty. So in that first decade of my career, from like 2000 to 2010, I sort of view my career as like trying to, the early part of that, getting my bones set up to become as good or as proficient a clinician as possible. And then the second part of that, I was already dipping into this space of healthcare simulation, whatever that was, and then health professions education or medical education. Like I really zoned in on medical education at that point. And so I was a residency assistant, then associate program director, and got interested and was a little bit intimidated by research and scholarship, but nevertheless got administratively sort of my grounding. In the second decade, because now I have a career that's over it's getting into the third decade now. From 2010 to 2020, like that period of life, if I break it up halfway, the first part of that was like, wow, I want to be a master educator. And so I went to, not having done a fellowship and having done enough CME, like the teaching fellowship that ACEP EMF offers, and then doing the Merck course and a couple of things. I was trying to sort of put together my own sort of mini fellowship and then grandfather into the field. Realized that I needed some formal training. One was at my institution, they were looking for others. And I was like, wow, I need to have some sort of subspecialty expertise and I need something that proves that. And also my knowledge base just wasn't as good as I thought it should be, not having had formal education. So I went to get a master's. And the master's I selected was relatively local. It was relatively expensive, but it was suggested that I go there because it had a new cohort and I came in as cohort 1A into that program. And so the program's not important. The fact that I got the master's, I thought was. It was largely self-directed, but it was something that I had to show up for too. I had to travel. So I had to put some skin in the game, I guess, or I had to put it had some teeth to it. And nevertheless, I get a lot of play out of that now, having had the master's. And so I expanded my career, not just from medical education. I left residency administration by the mid part of that decade and then was really just dedicated to simulation, healthcare simulation at that point. I had gotten moved up in that period from an assistant to an associate medical director at an organizational sim lab that was outside of emergency medicine. But within emergency medicine, I was known as the simulation person, maybe effectively the director of a division that really didn't exist, but culturally was present. So we did medical student simulation, we did resident simulation, and then we said we need a fellowship. So I became a founding director of a fellowship somewhere, I believe it was 2017 or so. Had a first fellow, and then since I've had several classes of fellows since, and I've since legacied and transitioned that fellowship to another excellent person. Like I had to recruit faculty, I had to get others, and realizing that by the end of that decade that this is a team sport, couldn't do it alone, and for success needed to get others. Now I'm in this phase where I'm looking to, along the way, I went from assistant to associate professor. So by 2014, I had associate professorship, and now I'm putting in my application for professor. So I need some letters, and then also need to get the application together, need time to put that together. So I'm looking forward to this conversation as well. I'm now looking forward in the third decade to transform into an education scientist. That seems to be the thing. And it's a thing that I'm really interested and passionate about. So I left emergency medicine largely as an administrative function. I still have a fledgling tiny bit of practice, but now I'm more trying to build an education research center centered in simulation at our organization.
I feel very inadequate. I don't know if I should be part of this panel. It's very nice to meet you guys. I feel like I am the newcomer, I suppose, but I'm Todd Chang. I did medical school at USC here, and I'm going to talk more slowly because I'm Californian. So I was at USC. I did my pediatric residency and pediatric emergency fellowship here at CHLA. I tried to be an East Coaster. I was in Children's National in DC for a year, really enjoyed it. Did some simulation there and came back for family reasons and have since stayed. What else do you want to know about the promotion process? Simulation. I got involved in simulation, I think very different than previous two panelists, through research first and then education admins later. So kind of a very different triangle, but those three parts of the triangle are very fundamental to simulation. You kind of pick one of those arms and then you kind of bleed into the others. So admin, research, education. And so I came in from the research side through the POISE network, which was there was a group in New England as well as a couple other sites in the US that attempted to improve first-rate lumbar puncture success rates for infants, which previous to that was about 65-70% among interns. And we did a fairly large multi-center simulations trial, which was a lot of fun, actually, because it was a bit of education, but you got to do research from it too. And so I got more into the scholarship of simulation through that realm. And then as we kept publishing and publishing, going that particular route, I actually attracted the attention of PCARN, which is not typically a sim place, but I think most of you know PCARN. But one of the newest highlights of PCARN as the head injury rules get rolled out was this idea of implementation and dissemination. And the method by which we needed to do that was unclear to PCARN. So I actually joined as a simulation research expert so that I could be part of the implementation, so that when there were DKA guidelines that are suggested by PCARN data, I now get to go to community hospitals and run a DKA scenario, and then our educators will teach, and it kind of completes the cycle of research. And then I tag along for publications because of that. So it's interesting that simulation can be used outside of the pure education realm, where it's either implementation as an arm of QI or as the testing ground for a QI that you do to see if things have improved for a rare situation, for example. I think that's how I got really mired into the simulation. And then therefore they started asking me to do teaching scenarios, and then eventually the medical director for simulation. So now I have to do budgets, which is not my favorite thing. So that's how it came about. The promotion process went to associate maybe in 2015, and mostly due to just a fair amount of research side of things. It didn't necessarily have to be simulation. It was just, oh, you did publications. Great, thanks, associate professor, right? Because you guys know that those researchers seem to have a slightly faster track or an easier track than the rest of us mortals. We're like, how do we showcase the fact that we're now associate or full professor? And then now, I think, Michael, I think I'm in your shoes. I'm about to do the portfolio for going up to professor. And as long as you show regional and national influence, more leadership opportunities that are not just hospital, but a little bit more wider scale, then you have a shot at it. And so we're coming up with a portfolio to showcase the three different arms of simulation, essentially. The VR. So the other big part of the career of VR research happened in 2016 when Facebook moved over to not too far from here because it was too expensive in San Francisco. They had acquired Oculus as a company, and they were looking to create public policy statements and social media campaigns, because they're really good at it, to push virtual reality, not just for teenage males with angst issues shooting and stuff. And so they had something called VR for Good, and they had multiple different domains, and one of which was healthcare, and we got involved with VR for Good for healthcare simulation. They did a massive social media campaign, of course, on it. We were able to do some publications out of it and looking at the effect of VR in terms of training as well as stress physiology to design a very stressful emergency setting with the status epilepticus infant. And so that was really well received. And then since then have had multiple different companies approach for different research opportunities for simulation. So right now we have 3 different companies working with us for VR related research, all 3 of them outside the US for some reason. And it's been a lot of fun. It's a very different way of using simulation as a modality. And again, for me, research was the easiest way to get things coming in. Way less regulation, contracts are way easier. And then we let the clinical medical directors and you two deal with the real contracts after the research people have done play with it.
All right. Thank you so much for the introductions. So yes, I want to open up to our audience, and you guys can just unmute and ask your questions, or you guys can put them in a chat and I will monitor the chat. So one question that I have is, with current work-life balance, and then also people saying, some people telling me that you should say yes to any opportunity that comes to you. And then there's some people who are like, no, you have to say no to things. Otherwise you'll be like overstretched. How do you guys find the balance between saying yes and saying no?
I think it changes. So you're kind of in your first couple of years out of residency where you're or fellowship, where you're establishing your academic career, you are going to probably say yes more often to opportunities because you want to see different things. And I found just like emergency physicians do a really good job in the hospital because they kind of touch everybody and they kind of know, they talk to everybody. I feel like when you're first in academics, that's a good way to get to know all the different facets. So I say, sure, I'll teach in the weird first and second year medical school class because I want to see what that's like. And okay, I'll hang out on the admissions committee and see what happens with people coming into medical school in addition to all my sim stuff. So I think you do say yes a lot more. You have to be cautious and careful and make sure that you're not involving yourself in things that really are out of touch. So I always knew I wasn't going to be a basic researcher, or like even a clinical researcher. I tend to do academic and educational research, so I wouldn't say yes to those kind of things, but I think you have to. And then after you kind of go through that first level, you want to have focus so you can get promoted based off something with focus, right? And then as you get promoted and you go into your second round, you get a little bit more focused and you really need to focus and start offloading and getting rid of some of the stuff you probably said yes to before, like the admissions committee or whatever committee it may be, and really focusing. And then I'm at a different level now where I'm like, ooh, what do I want to do? I don't want to do that anymore. I want to do a DEI committee for my ED. I don't really want to go to the admissions committee anymore. So it's kind of a career trajectory, and you have to take a stop point and figure out what's valuable and what's not.
Yeah, I'm going to say the same thing that Elise had mentioned, because if you're saying yes to those opportunities, it is an opportunity. I did realize as my career went on, I got married, had a child, and I started saying no to family. And I found that was a very difficult dynamic. So I know they always sort of describe that there's this work-life balance or that there's integration, maybe no balance necessarily. So I found a better integration that works for me, but I had to be very careful. One of the things that was a good offshoot was I had to learn how to transition away and let things go, because that's a hard thing to do sometimes. And at the same time, learn that I needed to move away to make room for others. And if you're not growing people underneath you, then you're not truly, in many views, you're not really an effective leader. You're not a leader in the field if you're not growing a legacy tree or helping make space for others. So it's a win-win for all. And so I've really adopted that. That was something I had to learn. I didn't learn that, and I've taken very few business courses. So that's something I should have learned from maybe Elise's experience. And I would say, like Todd had mentioned it as well, research is a team sport. So I find that if I wanted to get more involved in educational research, then I had to, first of all, learn that. And I also needed more time to do that. I had to get out of the other things I was involved with. That was very hard once I committed to them. To be careful.
The other kind of key point to that, and then Mike and I have both learned through trial and error. Like if we started a paper together right now or a project, we would know these things, but you basically want to make sure that everything you're doing is pretty well documented as well, because if you don't do that at the beginning of your career, you're going to have done all this stuff, even teaching these sims, and you never wrote it down, and you never had outcomes, and you never had a survey afterwards, even asking if people liked it. And so you have to make sure you're very careful about documenting that stuff. Tina probably knows this because I've hammered on it almost like my entire career, is that you can say yes to things, but make sure you're getting the outcome out of that, even the minutes of the meeting or whatever it is. So that's just key as you go through.
I've started taking selfies with simulations that I run with the participants and some sort of clock or calendar behind me. And that's your living record of your attendance. And they're millennials and Gen Z, they like that stuff. So they think you're not doing anything academic. It's actually academic.
It
So
totally is. My
yeah,
first promotion packet had multiple videos of us doing sim. So I just put the links in there now. So like the world's your oyster with your promotion packets now.
yeah. So for simulation, you have to be extraordinarily creative. Like one of my submissions was a video game plot development, which stodgy internal medicine guy is gonna like understand what the heck that is for promotion. So, and I agree. I think in the beginning you will say yes more often, but I personally think that you should have some sort. It's like bowling with bumpers. You need some bumpers, but the lane is really, really wide in the beginning. And then as you move forward, there are less and less pins, so you have to be way more narrow in your scope. For example, for Penn Fellows, when they're thinking for their research projects, it's much easier to say, if you're EM, you're interested in everything. That's the problem. But it's easier to say, okay, I don't want to do research in phosphokeratosis. I don't want to do research in blah, blah, blah. And you realize that you've actually had really good bumpers now, and then narrow it down to the possible opportunities in between. And then I actually had really good advice from Mary Patterson. She's a pediatric emergency medicine physician. She does a lot of simulation, and her started in Cincinnati and moved around to different places. But she actually said that on any given day, you will never feel like you have work-life balance. On any given day, you will feel like you're betraying your child for some work thing, or that one of your colleagues is getting a promotion. You're like, oh my God, that should have been mine. But what happens is that when you look back cumulatively after months and months and years, you will see that it will land closer to 50-50 over individual days or weeks that feel very lopsided in one direction. And that's okay as long as you swing back later. Right. So work-life balance is not a day-to-day problem. Right. You will like too much today and not enough family today. It's just going to happen. And then next time you'll spend way too much with your kids and they're like, oh my God, I'm crazy. And I need to do some work. But add it together, it's 50-50.
I really like that. I really like that 50-50 idea. What questions do people have?
And then Michael, when you're ready to start, I'm happy to work with you. I have plenty of stuff to research, and I've actually offered my colleagues one of my shifts if I complete their IRB from beginning to end. And two of them have taken up on the offer. Don't tell my division chief this. So I'm happy to help you with your IRB.
Thank you.
I don't think I can do your shift though. You can do my shift.
That's awesome. No, it definitely resonates. What you were saying definitely resonates with exactly what I was thinking. So I was typing away as you.
You're looking at different faculty development activities. Do you just do it on your own time, or how do you ask for those things from your leadership? Like right now I'm doing a master's in med ed that I'm just doing on my own. Like I've asked, my division has definitely covered some parts of my tuition, which is awesome, but the time and stuff is completely on my own.
I found that too. I mean, I did the MBA on my own. I did it when my kids were small. So it was more of like, it's an online thing, and I was able to kind of time it out in the right way. And I found there was very little in the way of development. And it was at any place I've worked. It's not place specific. It's just that hospitals are so like haggard, man. Like they are like the margins are so small. They're like operating like the worst businesses in the world just because of how we reimburse healthcare. So I say this from the admin side. There's no like, it's hard to invest in your people. I mean, we have the regular grand rounds and question writing and that kind of stuff that all med schools have more or less. But as for like big leadership development stuff, Harvard Healthcare had a little bit more that I kind of was involved in, but mostly I pursue it on my own. That's what the Sim Academy is for. That's what the conferences are for. SAM, I sit on the finance committee and multiple other committees throughout it. Like the whole goal is to give you guys that, like to give everybody that. That's their entire premise. So they're nonprofit. So I kind of think that that's where throughout my career, I found it. Like that was the place.
Yeah, I definitely didn't get a lot of support, but I also didn't go looking for it either financially wise for the degree, because I think I had this perception that there would have been some sort of strings attached. And at the time I did it, the degree that is, I didn't want the strings attached. So it was a conversation at home, actually. Like at that time I had a partner, I had a young daughter, and it was a discussion point. And it wasn't a bad discussion point, but I have a great spouse. So she's very supportive and said, do it. If you think this is something you're going to do, don't wait. Like just go ahead. So I wish I had done it earlier, but in the trajectory of when I caught it, I think I was among an earlier cohort of people that thought getting a degree like that would have been useful. And now I see a lot more people getting that degree or even going beyond and getting a PhD. But it's also like a bit of imposter syndrome. I'm ignorant if Todd has a degree, but I don't think he needs a degree to do great research. Like he's professor and he's going to accomplish that without the need for a degree. So a degree can help build skill if you don't have it, but you don't have to wait for something like that, or you don't even have to. I mean, like I even ask this as a fellowship director: what's the value of the fellowship? If I'm going to, when I was a fellowship director, I would say, wow, if you're going to come into the fellowship, I better make a justification for how I'm going to use that year of your life, because it's more than 1% in most circumstances. So I better use it well. And do you need that year, or could you do it on your own? So sometimes people need the program. And so I needed that master's. And so that risk reward benefit, that trade-off worked for me, but it may not work for others. And you don't need it to sort of advance your career. You can get there without it. So maybe the thing is just to feel that you're empowered enough to be able to do it. And you obviously, I think most people have the ability to do it. Go forward, do it, and make your career what you want it to be. Because if you wait, you won't get anywhere.
Yeah, I agree. I did the MBA because so you like learn little things from your mentors. And so when my mentor originally went up to be director of a sim center, they were like, well, you don't have any business administration experience. How are you gonna do it? This is like this is a white male, like who was in his like late 40s. And I'm like, oh God, I better get an MBA because I am coming up as a young female who like is going to be in that same position in 10 years where somebody's going to look at me and say, why would you run this? So, and that at the time was the goal. So I pursued the MBA on my own, knowing that that gives you a little clout. And I mean, it's worked in that sense. And it also is super helpful to have taken those courses and understand how meetings should be run and understanding all the kind of financial background stuff. And much of it you learn on the job, but the MBA was super valuable for both career trajectory and investment. So I wrote there, I'm not even involved in it, but it's like the Association for Physician Leadership, and they have courses, and then they have a selection of different online or partially online MBAs that their courses roll into, and you spread them out over years. And it was doable for me. I would just kind of put that money aside each semester to pay for it. It wasn't crazy, and it was like not terribly hard after you've done med school and MPHs and all the other stuff everybody does. So
it's really the time spent that's more valuable. For master's work at the junior faculty level, when I advise the junior faculty, it's usually you need extra scaffold and structure to do a project that you normally would have done locally or whatever you would have done, but it would have been very frazzled and you didn't have the right mentors. And it wasn't time to venture out. You didn't have the time. So that's the scaffold for a master's is really useful in years 2, 3, 7 of the junior faculty who really need that like proof and structure. You also need people who can work with you. For a mid-career person who wants to do a master's, it's usually a career transition where they've done a whole bunch of clinical work or they've done one thing, but they really want to switch over and do different leadership roles. So MBAs, for example, is a really popular one where you've actually seen enough stuff on the ground. Now you want to do something about it. So that's where those come in, right? There are different reasons to get masters in every part of our different lives. So it's wonderful when you get it, but it must be for the right purpose. Otherwise, you're okay with doing little certificates and mentorship and ad hoc things.
Yes, I totally agree. It's definitely less about the piece of paper, more about the transition and supporting a transition. And so, yeah, the way that I would frame my career, I'd say that's how it fit. It fit in that career transition that I was making from this clinician who wanted to be like an educator. Wow, can I be a master? Can I be what a great educator is, whatever that is? And so I thought the degree would help me out, and it gave me bones to start thinking about educational scholarship. And now if I'm going into this research space, that's where I'm feeling like, wow, do I need to get some more development? And hopefully I feel secure enough to either find it out there. Although I'm playing with that idea of, do I go back to school? Like that's another thing. But how do I do it now when my daughter is now 10 years or 15 years older? How do I think about doing that sort of work, and where do I do it? And is it worth the investment at this stage of my career? It'll take me several years now probably to do something more. And so is it worth it? Should I just do it? and just do the work, that is. And the work is there to be done already. So why necessarily get the degree? There's got to be some other, in my conversations at home and with colleagues, it's part of it's probably like an ego thing. Oh, I don't feel complete unless I've got this. That's, what I would say, just to spark the discussion, is it seems like people nowadays seem to have careers that transition. So it seems like we've all started out maybe we all have clinician identity and maybe our practice as clinicians as a base. And yet I'm finding in emergency medicine, at least when I speak with other EM folks, I see a lot of people in my organization, and we've got like a couple of hundred of them, and I see them transition somewhere between 10 and 15 or even 20 years into, not that they lose a passion for emergency medicine, and not totally that they get burnt out, although that's a real thing, but they just get a newer passion that's even more interesting. Like, I don't know, like bored with EM, I'm not sure what it is. And so I used to think you could sort of keep both lives up. And now I'm like, wow, I don't even know that I can keep both lives. We need to make a transition. I'm feeling more than I need to keep both going simultaneously, because not that I lost a passion, but I have a greater passion for the newer thing. I don't know, maybe it's the new toy. I'm not sure. I don't know what people think about that.
I agree. And I mean, I have the unpopular opinion as a healthcare administrator that emergency medicine and like from nursing to through physicians and APs, like we're just scheduled too much. So our job should be probably half of what it is, which is why many of us do the things on the side that are super enjoyable. Like I would prefer to go teach transition to residency every day than walk into a shift and get things thrown at me. Like who wouldn't? But it's kind of, I think we kind of pick those paths and then we do. Mid-career, I can speak to that. You go into shift and it's rare things surprise you, right? Like they always surprise you and humble you, but it's rare that it's like a true shock. And as opposed to when, I don't know, personally, when I'm teaching or when I'm developing a new program, you're like building something new. You're building it. So I don't know. That's just me.
Building on what Mike C said a little bit, I did have a question that came to me, if that's okay with the group. So it seems like you guys all had experiences where I guess, how do you open the door that you want to open, right, in your own careers as you make these transitions? And then how can you identify why the door is not open? I say this because I think what you said, Elise, was really interesting to me, because you wanted this directorship role. And then you had this realization, gee, I'm not going to have credibility applying for this directorship role without this MBA. I need to get this MBA in order to have credibility. I'm just really interested in how you guys came to similar realizations and how you identify that path.
I'll jump in quick on the open the door, just to say that I found that, there had to be a belief at some point that I wasn't the imposter anymore and I'm allowed to open the door. I can touch the handle, I won't get burned, that sort of thing. So the idea that you go into a boardroom, there's an empty chair at the table, and there's the other chairs around the ring that you deserve to sit at the chair. Like that's a whole thing that has to be overcome. So opening the door is part by just feeling enough courage, and it's different in different places. I can only speak from my own experience, but I definitely had a long time where I didn't believe that I was one who could open door. And then practicing opening the door, baby steps, having a great mentor, having a sponsor that opens the door for you just a bit so you can actually swing it open is very helpful. And I wouldn't have been able to accomplish anything without that. And then being willing to take the chance. You miss 100% of the shots you don't take. I think Wayne Gretzky said that. So those are some things.
Yeah, Tina, I think I agree with that. And I pretty much, I mean, I've worked at two places majorly, but I would apply for jobs every 4 to 5 years. So at the beginning of my career, especially. So about 4 years in, I'd be like, I don't think I'm where I want to be. So let me go look around. And sometimes that worked to stay at my own job. And then eventually it didn't. I went around and they were like, there's a sim center opening at UConn. Okay, I'm gonna run that. So let me go talk to the dean about 4 or 5 different times over there. So I did that. So it's kind of a combination of keeping your feelers out as well as kind of pouncing when those come along. And like Mike said, not having imposter syndrome and making sure you're promoting yourself and putting yourself out there. I think in academics, especially when you take on projects and finish them and do them well, it gets recognized personally because so much doesn't get finished or done well. People a lot of times will start things and then clinical life gets busy or something comes up. We're all doing this on our spare time, many of us. So I think, just keep your feelers out, I think is key as well.
When I'm going to translate keep your feelers out to, it's the only reason for any of my lucky successes are the people around me. That's the only And then one day I realized I'm one of the people around them. I'm like, oh my God. But the doors open because people think of you, even when they're not ready to team up with you. They'll know that you are doing these things, or you have a little niche that, yes, you're EM, which means you can do everything. But in addition to everything, I do X, Y, Z. I think we in the EM and the non-differentiated world have a little bit harder time of putting ourselves out there. So you're not like the pediatric rheumatologist who studies left knee arthritis or whatever, and you're known for left knee arthritis antibodies. Oh my God, just boring myself. But we actually have to actively create our niche and our specialty, which is always, it's different and it's harder, I think. And so it's up to us. If simulation is your thing, then start meeting other people with different nuances of simulation. They'll suddenly have an opening, they'll have a project idea, they'll have a transition in their career where they're looking at educational scholarship and research. And so they have all the opportunities come from people who are thinking about you. And so it doesn't mean you have to like schmooze and be all like that, but it does mean that being out there, doing the due diligence within your field to either publish every once in a while, or at least attend meetings, like shake hands, talk about project, talk about your ideas, and willing to be a little bit vulnerable with some of your ideas as long as they reciprocate that trust. So yeah, I very rarely have done single person projects from now. In fact, my last single person project was clinical effectiveness, and I realized that was not my thing.
Totally agree with Todd. Yeah, definitely it's a team sport. And I do believe in the multiple wins. So there should be, if there's not something in it for everyone, then maybe it should be reframed slightly. And maybe a thing that I would also offer, I've done this myself, but obviously we're in simulation. So I have access to a simulation suite, and I know that it's difficult for me to communicate sometimes in these professional contexts. And so what I did was went to my standardized patient division and I said, look, I want to practice these crucial conversations myself. I'm going to practice with you in the sim suite. I want to be the student and I want to see how I come off. I know that we have a big meeting coming up. I just want to practice the pitch. I just need like 20 minutes. Just want to practice that. And I use the simulation suite for myself. Just the same way as we have a test training center and I go in there and I practice my intubations because I might not have done one. I might have watched a lot, but I might not have done one in a while.
And if you choose simulation, remember simulation is just a modality. So you can emphasize your simulation in a variety of different ways or pick a modality of simulation, a delivery system of simulation that you're most interested in. So one could be community ED simulations because they have different needs than say a tertiary care or a referral center. You could pick a modality like standardized patients or digital sims. Maybe you're just the mock code person, you go into quality and safety. Maybe you do scholarship and implementation research, or you're the sim person for all of your clinical research people who seem to be getting money, and then they suddenly give you money because they need an implementation scientist, and you're like, I'm not gonna, right? And that simulation by itself, you don't talk about simulation as if it's your end all and be all, because it's kind of like saying, I'm going to give you medicine, ... and not saying anything else, right? So you need to know the dose, you need to know the indications, you need to know what you're doing with it and the specific type. And that kind of allows you to get into these different areas that seem foreign to simulationists, but actually come with, funding and support and personnel. What you really want for true longevity, right? And don't be ashamed or embarrassed about asking for money when typically it feels that way early on, but you have to have either protected time or money or personnel in order to do the things that you want and they want you to do. So I'm going to do this at the level of expectations that you want and exceed them. I need to have this much amount of time. If you can't do this, what negotiations can we do to downplay the expectations?
Yeah, a little touching on Tina's question. I feel like when I look at all the different checklists to go from assistant to associate professor, there's all these things. I'm like, how do you even get a national talk? Like, how do you even do these things? Do you guys have any? Yeah, I know. That's one thing,
This is a
Jenny.
national talk.
Yeah, I know it is.
If there's anyone from Canada, it's international. Anyone from Canada?
And I think that's the key, right? Like SAM, you submit your innovations and your abstracts, and then you hop on the Sim Academy and you get involved in you get involved in workshops. I was talking the other day, we're doing a DEI committee for our emergency department and doing different researches on it. And we're talking about our new fellow wanted to do DEI sim. And I go, I think I was on a panel with Mike Cassara, like 6 years ago before the pandemic. And I looked it up in my email. I'm like, I was. So you just get involved in all of this stuff. Like you hop on, and that's how you get your talks. And you go to, I mean, IMSH is another organization, but it's international. So as soon as you submit a workshop and do it, it's a peer-reviewed workshop internationally that you just presented, and posters. And then, I mean, for me, SAEM has the subgroup in New England, so I chaired that meeting for a couple of years. I was on the education subcommittee, did finance committee for SAEM. So there's your committees. I do hospital committees. So we run for the little different committees we have, medical staff or whatever, and you get on one of those. And then the Sim Academy, I'm not president, but I can tout this, is that they have awards. And that's what those awards are for. Is like, those awards are not only to recognize people, but to help you guys get promoted, to help you guys. So submit yourself, submit somebody else you know. I mean, we have ones at our hospital. I say, I'm going to submit you for this. There's ones through CORD that you can submit for. ACEP has a junior faculty teaching award, and 50% of the applications get it. So you put it together. It's a pain in the butt to put together, but that's how you get your award. So the checklist, you just kind of got to get strategic. And you also have to, I mean, I think reaching out to those of us who've gone through it. If anybody sends me an email and asks me these questions, I'm always happy to answer it. I'm on that whole AWEM listserv of women who will respond if you need promotion or even a letter. I'm always happy to write letters. But you got to kind of ask about it, and ask other people in your department who've gotten promoted. And I mean, I've written letter. Mike wrote my first. Mike's written letters for me, gotten me promoted. Like, it's just a community you can use.
Yeah, definitely. It's surprisingly easy to get something accepted to a national meeting. So just don't feel like you have to do it alone. In fact, it's preferred not to do it alone. The networking is half the enjoyment, and obviously the more the merrier. So do that. And so if you have a team, any work that you do is usually divided among the team members. Even if you're the principal or the senior person, whether it's research or scholarship or just a workshop or something like that. So it's good to be inclusive in that regard, and do that. If you're preparing an application for promotion, then those meetings and all those other activities sort of get rolled in. So I would say if things like Glass 6 criteria and your promotions application process at your organization, if they're not familiar to you, those two things in particular, I'd sort of point out, and then maybe Boyer's scholarship stuff. But if that's unfamiliar, look at least at your schools or your organization's promotions packet, like understand what they need. Anytime you're putting that application together, I would roll that into an award, because in emergency medicine, we have these award structures that sort of mirror what the application for promotion is. So CORD has the Academy for Scholarship. They have a Distinguished Educator Award. The Sim Academy has awards that you wouldn't need as rigorous an application for. It's not like that sort of thing. But your organization may have an Academy of Educators. And so if you're in the education space as a simulationist, and your school has an Academy for Medical Education or a Health Professions Education or whatever it is, go into that space, and as you're preparing your application, either before or after, roll it into that award, and undoubtedly you'll probably get it. And if you didn't, then you have a sense of where your application sits and what do you need to do to improve it. And so it's going to be a little bit of a grind, but honestly, you'll probably not apply for those things until you're ready. And if you have a mentor, would be the last thing, a mentor along with a sponsor. But if the mentor is watching things, they'll tell you. If they're a good mentor, they'll say, look, maybe hold off on this, wait until this, and that should guide you accordingly.
And Diana, I also want to empower you. These local, regional, national impact that your university wants be yours to create. As the most extreme example, we decided to create an 3D printing institute within our simulation center. It is the stupidest name ever, but it's basically a conglomerate. We wanted to push a 3D print program because our radiologists can donate all sorts of Downs babies, airways, and Pierre Robin's intubation challenges. Oh, you guys are right. So like, how do you make that into an institution? So we decided to like talk about it, gather people, and we decided we wanted to make a talk about it. And so we did a talk, and we got funding, and now we have a national conference, right? And it's not to say like you make stuff up. Don't do like a Zoom call with your friend for 5 minutes and call it a national presentation. But you have the power now to create meaningful scholarly experiences. So you use Glassix and Boyer's criteria for make sure you get your evaluations and cycle with learning objectives. And once you do that, you now have impact. And you created the impact that you wanted to do on your own terms and your own time zones. It's not necessarily just appealing for somebody to find you, which you should do, but also if you have something to say to the world, to the greater EM community or whoever, then it's okay to actually make something on your own with the team.
I love that you created a 3D printed institute. I don't think that sounds dumb at all. I think it's a great name.
I love the concept that we
Yeah.
need an acronym, you know,
Oh,
with
got
the
it.
number 3 in it that replaces
Yeah.
the letter E, so it looks like cyber, I guess.
That's right. That's right. I gotcha.
All right, well, we're wrapping up now. So I just want to thank you again. That was a really wonderful session. And I know I got a lot from it, so I'm sure everyone else did as well. I do want to promote our next mentor hour, which will be in the new year. And so we're going to be doing a trainee focused one called Working Smarter, Not Harder. And so if you guys have any panelists who are early faculty, fellows, or senior residents who have been able to accomplish a lot during their training, please let me know. And then I also included the registration link in the chat. Thank you, everybody.
Good to see you guys.